Hey, welcome back. Did you go out and get your favorite beverage to get jump into this? Anyways, so this little portion here, we're going to talk a bit about how the actual course works. We're going to go through some things so you understand how to get around and how do you hit complete. So there is a certificate for this course. This is not going to be set for Con Ed. This is meant for you to practice your skills on recall and practice exam taking. So let's get into it. So if you jump over here onto the website, you can see we're on the main page here. There we go. So we're in our currently beta testing, but that price will go up in a little bit. As you scroll down, it goes through over what you get. We got like over 1,100 copper questions. You got to remember that all these questions are kind of running in the PCP EMR realm. So sometimes they might not be exactly in your scope, but it's good to understand which scope you're trying to do. And that for being said, the first thing is the introduction to the content. That's kind of what I'm filming right now for you guys. And then the first section is the paramedic examination education. So these next 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 kind of lessons here. This just goes through on how to write exams. It actually explains to you how people write questions for these exams. It's how to dive into them and get them a little better, so you understand them, and that way you can actually take more time writing your exam because you'll be quicker at them and you can look for those. And again, it also will point out, once you understand how these questions are made for these exams, it also allows you to see, like, sometimes if you're going to a certain school, sometimes exam writers like to make the gotcha questions, and you'll be able to recognize those quickly. So what I'm going to do is, first of all, we'll just start off in the first how copper and other registration exams work. You click on it, it opens up. You'll have the education over here on this side. You'll have the list of lessons down your left side. And you can scroll all the way through them and you can see all the quizzes. The other thing too to look at is that you can scroll all the way to the bottom of the page. You can see we kept some of the notes detailed, and it has back to course. Now, there's a bunch of topics you have to complete before you complete this lesson. I click on the one topic, and you can see up here there says mark complete. So every time to get the certificate, you would have to pass 75% on all the exams, and you got to click mark complete on every topic. That being said, I'm going to go to the next topic, which it brought me over there. Again, I'm going to mark complete. Again, you can just see if you don't want to do the work and actually do the practice, you just mark complete. Now over on this side, you can see that now that lesson has been marked complete because you've finished all the other components. As you can see, I've already done the quiz on that one, so it's okay. That being said, this is it's not going to force you to go from 1 to 20. You can go through this whole course and just use the pieces that you need. And as you go through, the big thing is to remember that a lot of the videos, to be able to mark complete, you have to watch the entire video because they are monitored and connected. With that being said, you get down to the patient care review. You can understand a patient care assessment. Again, it just talks about the scene size up. Basically, it's just bullet points for you to quickly look at different things. We might be adding some videos, maybe even some external videos where some other people have done some great work on showing you how to do this. And then at the bottom of that, as you can see here, again, it lists a bunch of different other topics to work on, general history taking. And again, on this side, you can see there's 10 topics. Once the 10 topics, then the patient assessment will be complete. So basically that's it. In a nutshell, that's how the instructions work. That's how you get around in it. Just remember that you're allowed to jump all over the place. I do suggest doing the paramedic education exam writing portion first and then move on. Thanks a lot.